Vaccination update news is that we are now putting out a weekly report as soon as we get our allocations from the state. The state did say in their guidance to providers that those allocation numbers would be available each week on Friday. We got them at 11:48 on Saturday this week, so our report went out a little bit late. But we are thankful that we are getting, once again, 3,400 doses. We were concerned that it might drop again, as it had, to the health department. Concern Anne Arundel Medical Center, which had gone from 1,000 to 5,000 back down to 1,000, is now at 700 this week. Also concerned that of the doses that the State Department of Health made public in that notice, we know 88,000 are coming from the feds, but only 49,450 were listed in that notice. So the other 38,000 plus, we're not sure where they're going. They're not publishing the data on how many doses are going to their pharmacy chain partners or to their state mass vaccination clinics. So that's still an unknown. We did have a lack of second doses. Dr. Kalyana may talk about how this all worked, but my understanding is that we were told second doses would be coming from the state based on their orders from the feds of the Pfizer vaccine last week and the week before. And it came down to the day that folks were scheduled, and we had to reschedule 1,374 of our residents scheduled for second doses. And I apologize to every one of those people that this was necessary, but if the doses aren't there, we can't put them in your arms. So believe me, we are working as hard as we possibly can to get those doses from the state, and we're told that they will come now on Wednesday. We hope they will. Also had to do some rescheduling as a result of snow once again this weekend, 2 weekends in a row. And I just want to thank all of our health department staff, our Department of Aging, my community engagement constituent service staff that's been deployed to make thousands and thousands and thousands of calls. There are 2,500 calls a week coming in just on the COVID hotline, and the work that our team is doing, particularly our health department, to make all of these changes happen is really, it's amazing to see. And we're getting a lot of emails from folks thanking us for stepping up as public servants and doing this extra work. We have 116,000 in our COVID, aacounty.org/COVID-vax pre-registration system. And of those, 16,000 are still folks over 75. Now, it's possible that some of those have gotten vaccinated and did not remove themselves from our list. That's one of the frustrations of having so many different pre-registration sites for the different providers of vaccines, is it's impossible to know exactly who's gotten vaccinated at that stage of the game. The way that we're doing our selections from that list for our county vaccinations is that we have software that randomly selects within the priority groups that have been identified and produces a result that reflects the demographics of the county. We also have our team at the health department has been working on an extensive equity plan that will be going to our task force for review at their next meeting that we'll be talking about probably next week to make sure that the doses are going into the arms of all of our residents, including those who are most vulnerable and underserved in their communities. Of the 3,400 doses that we are getting to the health department this week, we made a difficult decision to divide it up based on priorities. 1,500 will go to seniors 75 and over, the most vulnerable from a health standpoint. Another 1,500 will go to educators. And of those 1,500, 1,000 will go to our Anne Arundel County Public School staff and 500 to private school and childcare educators. The ratio is 2 to 1. That's about the ratio of the population in those different groups. Of course, our Anne Arundel County Public Schools is being vaccinated by the fire department, and that's being organized through the school system. So they have the names of those teachers and educators, and are handling that. So if you're a teacher in the public school system, you can go elsewhere to try to get vaccinated. Everybody is going everywhere at this point, trying to get vaccinated as soon as possible. But make sure that the school system has your name that you want to get vaccinated. They did a survey and should have that. And I just want to apologize to everybody who is out there doing vaccine surfing. It's not easy. It's very time consuming when so many different providers have so many different sites. The most recent, I guess, to come up for our residents really is Six Flags. They're only 6 miles from the border of Anne Arundel County, and they opened up on Friday. We were not able to get our list to them. They first asked for a list of seniors over 65 actually, to vaccinate, and then a couple hours later they said no, they don't want that list after all. Then we're told that they got those names from Prince George's County. Still unclear. There is a state site to sign up for those vaccinations. Sometimes it accepts folks and sometimes it doesn't. When I tried it, they told me that there were no vaccine sites in my area to pre-register for. We are talking to our pharmacies. Giant is the one in Anne Arundel County that has sites. We are talking to the hospitals regularly, and we are talking to the state in the hope of getting partnerships established so that folks from our list can get sent over and get appointments at some of these other providers, and that is ongoing. And I also want to say that for our teachers, we need to get you vaccinated more quickly, and I am very acutely aware of that. And we have these conversations on a regular basis, and I really want to try to get as many vaccinated as possible, at least first doses before people go back to the classroom. We know that not only teachers are concerned about needing vaccines as they go back, but parents as well. So, we only have 60 to 70% of parents said they were not prepared to send their kids back to classrooms. And that just shows me that there is still concern, and we want to make our schools safe. So I can assure you that we are hustling to get all the vaccines we can and get them to teachers, while continuing to realize that our seniors 75 and over also have great needs. There was a letter that the Maryland Association of Counties organized. It's very similar to the letter that I had sent to the governor, and the topics that we talked about and the suggestions that we talked about for the state. 31 county officials from 21 counties plus Baltimore City signed on to this letter, and it has 5 requests to the state. They are, and we can make this available, or you can find it on the Maryland Association of Counties website as well, but to share the weekly allocation publicly and release it sooner so that people know, and include all of the providers, not just hospitals and health departments, in that information. So people know if they're surfing, who's got vaccines, where to put their time in. Demonstrate that counties are getting their fair share by population, and by publishing all of the allocations by distribution site. So not just saying how many a pharmacy chain has statewide, but how many locations they have in each county. Fulfill local health department weekly requests before allocating doses to private providers or state sites. And we all know the benefits of local health departments doing this. They have the equity lens. They have used taxpayers' money to stand up their capacity to be able to deliver these vaccinations. And we believe it's only right to ask them to stand up rather than stand down at this time, and provide doses to them first. We request each week how many doses we want. I believe we've been requesting 7,500, but getting 3,400 And then allow local health departments to operate one-stop pre-registration or create a statewide system so that people don't have to surf so many websites. And finally, expedite the release of the $400 million in federal vaccination testing and contact tracing funds, and provide direct grants to local health departments. We were notified last week that 114 million of that 400 million would be available to local counties, but not as grants, simply as reimbursement for expenses. And we have no information yet about how that reimbursement will work. But we are going to aggressively in Anne Arundel County use as much of that money as we can to provide services to our residents through the health department. I also just want to mention to people that there have been scams, people calling folks, particularly seniors, and offering them vaccines, asking to meet in locations for vaccines. Please, we don't call people to offer vaccines. We do call people about scheduling and changing appointments and things, but and there is a state contractor that has been hired by the state of Maryland to call people as well. I think that's part of the GoVax program. But beware, don't go meet people for vaccines in places that have not been published as vaccine centers by the state or by the county.
In the county, 62,000 vaccines done, 46,000 first doses. People got first doses, 16,000 have gotten both doses. So that's 8% getting first doses and 2.8% getting both doses. In the health department, we've done 22,000 first doses and 6,000 people gotten both doses, total of 25,000. We've received total of 25,000 first dose vaccines. Our allocation for this week is 3,400 doses again, and the county executive mentioned are split amongst educators, those over 75 and healthcare workers. That's why we're in phase 1B. We still have about 39,000 people who are pre-registered in 1B, and we do take names off the list after they get their first dose. And we're sure that a small percentage of people have gotten vaccinated elsewhere, but still 39,000 is a lot of people who have expressed an interest in getting it. And if we're getting 3,400 doses and the hospitals between them are getting less than 1,000 doses, it's going to take well into March to get through this group. So we really ask folks for their patience. I know it's difficult. What we're recommending is for everybody to get pre-registered. When you do that, remember that it's still important to wear your mask, distance, and avoid gatherings. We will get through this. It will take a little time, but we will get through this. A category that was added into 1B is people with intellectual and developmental disabilities, and we're working through how to ensure that individuals who meet that criteria can get vaccinated. Overall, we have 122,000 pre-registrations in our system, and that reflects over 20% of the population of the county. But we're seeing some inequities in how that's playing out. We see that of the pre-registrants, only 7.3% are Black, only 3.4% are Hispanic, so less than 50% of what we would expect based on demographics. Whites compose 78% of the pre-registrants, and Asians, the only demographic that's on par with its population level of 3.8%. And so, as the county executive noted, equity is critical, and so we're ensuring that when you signed up doesn't affect whether you get an appointment or not, as long as this is your phase. And so the appointment invites are being done randomly to people eligible to make sure that there's access to vaccines for everybody. One of the things we heard is, well, if there's a huge list, why should I bother signing up? Well, it's important to get your name there. It's important to demonstrate interest in the county, and we continue to push to get more vaccines into our county. And we're also adjusting our demographics of the invites to make sure that minorities are not underrepresented. That's a key part of this. We want to make sure that everybody has equitable access to vaccines during this time. one thing that we want to also highlight is that our mobile clinics will start going out, vaccinating at 2 independent living facilities this week. And we're working with aging and the housing authority in both the county and the city to ensure that across independent living, senior housing, and public housing, that every single one of those facilities has a plan for vaccination, whether that's through a commercial pharmacy, or through the health department, or through one of the hospitals, or some other mechanism. And those will be ongoing over the next number of weeks. As the county executive noted, we also obviously had to reschedule over 1,300 appointments between today, three clinics today and 1 tomorrow. These are all second dose appointments, and they're all for people who had Pfizer as their second dose. This is because we are short. We haven't received second dose vaccines that were due to arrive last week, and we have a shortage of 2,000 second dose vaccines that were due to arrive 2 weeks ago. And so we always schedule second doses at the time of the first dose so that people don't forget, so that we don't lose anybody. And implicit in their system was that we were going to receive the second doses on schedule. And so we are waiting for receipt of those overdue vaccines, and we're supposed to get them tomorrow. And we are rescheduling those 1,300 plus people on Saturday to get them vaccinated. And I echo the county executive in apologizing to those who are affected. I know it's frustrating, and that's why we want to make sure we get you on Saturday